Hi, today in video part 1 we're going to discuss a clinical case of uh, Emacs crowns number 19, number 20, how to approach the case, what my management in this case, and in the second part we're going to discuss how I used Omnicm to deliver this case. So the patient came to me with multiple cavities on teeth, on all his teeth, and for us as clinicians, we have to figure out what kind of restorations, what type of restorations we have to deliver for these patients, so to reduce the risk. Of course, we discuss for the patient all the treatment plan, all the high risk and of getting more cavities. Even we deliver something expensive restorations, crowns, onlays, inlays. But what's probably the best approach on patients who have high risk of getting more cavities? Of course, we discussed his nutrition, diet, his habits, and we prescribed some medication from care-free products to reduce the risk factors. But of course, the most important is to have his patient compliance. So in this case, you see that number 19, number 20 has multiple restorations, has cavities, understand some gingival, and I restored them previously with composite fillings, and today we trying to restore with crowns. So why crowns, and what type of crowns? We decided to place on posterior teeth Emacs crowns, and I'm going to be conservative preparation here, and also due to high risk of getting more cavities, the crown is going to be subgingival. So you will see the approach in this case, what system I've been using. Um, this is his buccal view. You can see the occlusal view of those teeth, number 19, number 20. So I've been using a hoist preparation kit, and I use this kit almost every day for almost all the cases. Special prosthetics, and the same kit I've been using also for my surgical part of my practice. So you can see the phone number of from the bracelet company, and you see the diamonds I've been using. Again, it's if I use posterior teeth, they see that case one. That's what we're using for posterior teeth. Some other teeth, some other bores I'm going to discuss the implementation during the video. So the patient is numbed, and the first bore I've been using is 330 bore. The shank of this bore is 2 millimeters, and I've been cutting the grooves, so make sure I have enough occlusal reduction. And I've also been using this bore is to break the interproximal contacts. So pituitary board we've been using is the grooves, and the second board I've been using is what we call case 6. That's to remove the occlusal portion of a tooth structure. You can see on this video right now that interproximal contacts have been broken with the board number 330, and now I've been using case 6 to do occlusal reduction. You also can use case 7 to do occlusal reduction, but in this case I would like to have a little bit concavity and follow the occlusal anatomy of posterior teeth. So the occlusal reduction been done. You can see on this video, on this picture, and the proximal reduction been done. And the another bore I'm going to use is what we call case 1. So case 1 is 1.2 millimeter in diameter, and there's chamfer, and what's good about this bore is you can go all around 360 degrees without making any ledges on the tooth structure. So it's a nice board to have. And I usually cut in 2 planes. This you can see this what I do in buccal area. Then we use the same bore for the gingival third. So I'll go around and remove the tooth structure according to the thickness of the bore, and I've been using also this to go to the final stage of my preparation as the polishing or adjustment of the prep. I've been using the cord. So in this case, because the cavity is subgingival, I've been using a cord from UltraPack. It's number 2. So I'll go subgingival and place the core around 360 degrees, and also is going to help me to produce a better bonding on those teeth. So the another things I'm trying to use also is use my soft tissue laser. Sometimes you see overgrowth of the tissue, and when I'm trying to scan or take the impressions, I want to make sure that my margins are clear and visible from the occlusal point. So if I can see the margins, it will be easy for me to produce or fabricate the restorations. If I won't be able to see it, I use more cords or probably use a soft tissue laser as you see on this picture. So the next step again, it's we're going to use bore case 6. It's a fine diamond bore. I'll go around of a tooth structure to make sure it's remove all the irregularity during my preparation. It's smooth the margins, but you can see that the bore is very big. Sometimes it's very difficult to get into proximal areas, and at that time I've been using KS0 fine to go into proximal and polish my margins. So the KS6 also I've been using it for my crown lensing procedures, especially in the proximal area, or reduce the bony defect. So during the preparation, once again, it's when the preparation is done and I'm ready for my next step is using like Omnicm or Ceric, or if I'm taking regular impressions, I use my microabrasion prep start. And I've been using 27 microns of aluminum particles and also 40 psi the pressure, so I can reduce any again, let's say irregularities on a tooth structure, any debris from a tooth structure. So uh, my impression or my scan will be nice and clean. So when the preparation again is done, we fabricate the restoration, and you can see how the smooth margins are. That's the clearance between interproximal and interocclusal space. So I use Omnicam to scan, or someone who using that impression material can probably take the impression of the prep. And the next step is going to be, of course, delivering the restorations. So in this case, once again, before I start delivering my restorations, I've been using again prep start to clean all the debris or contaminants from the prep or from the chemicals if we use any chemicals to stop the bleeding. And when I establish the hemostasis all around, so again, the prep start is going to be the first, and then depends what I have left from a tooth structure. So in this case, I'm going to use the dentin bonding protocol, and I'm going to use all bond universal from Visco company bonding agent, and I'm also going to use Unicem 2 as my final cement. So that's kind of protocol I have, and again, it's when I cement my crowns. Again, the patient is numbed. I've been using a special scaler from the Brilson company to clean the proximal areas to make sure I don't leave any kind of residue of cement, so it will not cause any kind of complications or inflammation around the gums. So I go aggressively and remove all the cement wherever it's possible, and so to make sure it's when I deliver the restorations, they have no residue of cement left. Then to see that if there is any residue of cement left, I've been using a brownie. You see that's on a hoist preparation kit, and with a with a 10,000 RPM, I've been polishing my margins all around the crowns. And sometimes if there is a residue of the cement, it will leave like a brown stain on that part of the crown. So I know that's where I left this extra cement. I've been in a cleaned area. So this is again the instruments I've been using on the patient. You can see the final X-rays. and also this final restorations. Again, on the second part of the video, you will see how to approach this case using Omnicm.